Assalamu alaikum and welcome back to Medicower on Iqra TV. The subject for today has been around strokes, and we're still in the middle of the conversation. And I thought, just to make sure that we don't miss any crucial points, Liz, perhaps I can ask you to give us a recap on what we've been talking about in the first half.
Well, if you remember, Rabina, what I wanted to highlight was a stroke is like a brain attack. So just as we would always take a heart attack very seriously, a stroke should also be taken seriously. So stroke is when a part of the brain is not getting the right amount of blood. Usually it's because there's been a blockage, but it can be because there's been a bleed. Now, our brains control our body, so a certain part of our brain controls our arms, another part of our brain controls our legs. The left side of our brain controls the right side of our body, so if the problem is on the left side of the brain, it will be the right side of the body that's actually affected. So depending on which part of our brain has the attack, then the symptoms of that will differ. So it might be that you can't lift your arm, it might be you can't move your leg. But if that happens, we need to be moving quickly. So Rabina, what's FAST?
FAST is F for face, A for arms, S for speech, and T is for time, that we need to act quickly.
So what might you notice with the face?
That it might droop.
Yeah,
there's some sort of change on one side of the face more than another.
That's right, one side, not the other. What about arm? What would you notice?
You'd probably notice some sort of weakness. I feel like I'm having an exam here.
No, you're doing good, you're doing well. You're on for a grade A so far.
That you might suddenly find that you've got no movement in it,
no
or strength
power,
in it.
Yes. What about S, speech? What would we notice?
You might find you're either slurring your speech, or maybe you can't even get words out because even though you're thinking them, they're not coming out because you can't control your...
Or sometimes the wrong word comes out.
Oh yes, you said
I mean
that
to
too.
say Rabina, but I shout, Fred, Fred. You know,
I think call that as well.
Well,
sometimes.
I bet you've called worse than that as well. So it can affect all those things.
Okay.
Important to act fast, because what we do know is if you have a stroke caused by a blockage, there is treatment for that sort of a stroke, which can make a huge difference to how you are long term.
It's that quality of life issue, isn't it?
Absolutely. So I'm not saying it will always completely be as if you'd never had a stroke, but the possible disabilities after your stroke may be a lot less. But the time factor is absolutely essential. That's why, just as with a heart attack, we're on the phone, brain attack, same thing.
Okay. So let's say that, I mean, I guess we have to recognise that some people after a stroke don't always have a good quality of life afterwards. Their ability to function the way that they did before the stroke could be so different and so much reduced. But if somebody is fortunate enough to be able to go home after a stroke, and we kind of hope that they do, what kind of help is available to them at home, especially if they don't live with a family that could help them?
Well, we have to keep saying, don't we, everybody's different. So everybody's stroke will be different. One man's will be different to the next man's. So first of all, the treatment and the care given in hospital may make, and will make, I'm sure, a big difference to a lot of people. So it may be immediately after the stroke, somebody wasn't able to lift their arm at all, or wasn't able to move their leg. But with the right sort of help from the physio, etc., they can make great progress. So they may not have the same strength in their arm, but they are able to still use their arm. I was saying, for instance, Rabina, I don't know if you've ever broken your arm, but you could still dress yourself even if your arm wasn't move as well.
Don't I mean, I haven't broken my arm, but thankfully, but I imagine it's like anything. If you've got a pain or you've got something that sort of changes your ability to move in the same way, you adapt in different ways, don't you?
So your leg, one of your legs might not be as strong, but with some help from the physio, you will learn how to get out of your chair, how to walk. You may need a stick, you may need a Zimmer frame, but you can make major progress with the help of this team of people. And I do emphasise team. So we've got a physio, we mentioned an occupational therapist.
What do they do again?
Well, things like if you've had a stroke and you're not as strong, can you get into your bath? Do you need a shower? How do you make a cup of coffee if you can't lift the kettle because you're not as strong?
Okay.
So there's all sorts of ways. What about getting to the toilet? Can you manage that? One common problem after a stroke is incontinence, and that's waterworks and bowels. So I know this is not a nice thing to be talking about, but unfortunately these are the disabilities some people can have.
So would they be helping you to relearn skills, or would they be looking at adaptations?
Well,
to
very
help you?
often, I think it's both. But for instance, adaptations, I went to on a home visit to see a patient not so long ago, and they had an elevated toilet seat because their mobility was difficult. They were managing, but sometimes toilets can be quite low. They would really struggle. So a special seat meant they could sit down easier, they could stand up easier. So it's adapting where you live. Now you mentioned some people may have family. So obviously life is going to be easier, but some people don't have the benefits of family.
And sometimes family, despite being there, they're they've got commitments that means that they
to
can't
work,
be there as
etc.
often as you'd like. Yeah.
I think though once patients leave hospital, and we often refer to it as a stroke unit, so that might be a little area in the hospital where various wards are very much to do with looking after people with strokes. When people go home, if they're able to go home, then there will be a team in the community attached to primary care or working through primary care who can then see the patient regularly. The team will again have physios, occupational therapists.
So is primary care sort of attached to the GP kind of
Yes, that's
services?
right. So primary care, I am meaning general practices. So when everybody leaves hospital having had a stroke, quite a detailed letter will be sent from the hospital to the general practice, so the people within the general practice team
That's your
know
doctor,
what's happened. Something we haven't mentioned and we should do is, because we talked about causes of strokes, for instance, high blood pressure, poor diabetes control, high levels of cholesterol, there is definitely certain medication which people should be taking after having had a stroke. Do you remember we mentioned one of these common strokes is the blockage stroke?
Yes.
So patients after that sort of a stroke will need to be taking certain drugs, for instance aspirin, which reduces the risk of having another stroke. People whose blood pressure is high need to be taking tablets to bring their blood pressure down. People whose cholesterol is high will need to be on cholesterol tablets.
So for people who aren't keen on taking tablets, are you still of the opinion that actually this is one of those occasions where you don't want to mess about with this because you do need the tablets?
If your blood pressure is very high, you are at a risk of having a heart attack, beg your pardon, of having a stroke. You can do all sorts with lifestyle, and that is just as important as the drugs. But even if you've tried your best with lifestyle and you are faced with, you may have a stroke because your blood pressure is too high, then everybody has to make their own decision. But for a lot of these things, lifestyle, terribly important, but drug treatment can be, I would say, quite essential. But it's an individual choice.
I appreciate that, because I think I'm somebody that prefers not to take medication, but I don't deny the fact that there's a time and place for it with certain conditions.
And I think things should be explained about what you can do to help yourself. We talked earlier about physical activity, getting some exercise.
But that takes time, doesn't it, to build
it does.
up?
And if you've had a stroke and you've got a disability because of that, one thing we haven't touched on, and I think we should, is the psychological implications of a stroke.
Some people say that it affects your personality.
I think it can do. And actually the incidence and the chance of having dementia after a stroke increases dramatically. Personality can be altered by a stroke.
And to what extent, though? I mean, we talk about a real personality change?
Everybody's different. Yes, I think we can have real personality changes. From a gentle, soft person to somebody who can be more aggressive, more angry. And I think as well, if you or I had God forbid, had a stroke tomorrow and we lost our independence, we can't just walk to the shop, we can't just go for a swim, we can't just drive our car, we can't just write a letter, we can't read a book. I haven't mentioned that our ability to write and read can be affected.
Gosh, that's
How
a
would that
massive
make you
impact,
feel?
yeah.
You'd be depressed, you'd be anxious, you may be very angry as well. Why me? Why has it happened to me?
Okay.
So huge, and just think of our family coping with this person who's they're trying their best to help them to get over,
and
and
it's
they're
so
faced with an
frustrating.
angry person. And let's face it, we all kick out at the person who's nearest and dearest very often, don't we?
So you've
So-
talked about that family and that personality change, and I guess what kind of message can we give to families who are caring for people? You know,
Well,
what's
I think
available for them to
You're
cope?
never on your own. So there is a lot of, we can Google stroke support.
Right.
There's a lot of carers associations to support people.
Okay.
I've thought of something else I want to mention. I think I did say that once you've had a stroke, you are at a risk of having another stroke,
You did.
hence the importance perhaps of the drug treatment and things. But I want to talk about, have you ever heard of a mini stroke?
I was just going to say that's one of the questions on my
Right,
cards.
I'm
What
glad
is
you-
a mini stroke?
Right, a mini stroke appears to be identical to a proper stroke, but it only lasts for a short time. Usually it can be only an hour or even half an hour. It can go up to a whole day, but at the end of the time, all those things which look like a stroke completely gone back to normal.
Now that makes it sound like this is precisely why it's important to still get help and advice if you have symptoms to do with your arms or your face or your speech, because if you're having a mini stroke,
Well-
you could actually sit back and think, oh, I'm better now, so I won't do anything.
Yeah. So a mini stroke is for exactly the same reason. Usually it's that blockage. In fact, it will be a blockage which isn't a permanent blockage, where perhaps the blood vessel has been blocked, but the blockage moves away quickly. So the part of the brain never completely dies. It completely gets back to normal.
Right.
So, but it can show with the same thing. I can't lift my arm, I can't move my leg, my face has gone funny, I can't find my words. But, and everybody's different, it will completely reverse within a certain length of time, and almost always less than 24 hours, very commonly less than an hour.
But it still sounds like it's serious.
It is serious because once you've had a mini stroke, the risk of having a major stroke is very high.
And within any space of time, or?
Well, it could be within a day, it could be within an hour, it could be within 3 weeks, it could be within 6 months.
All right.
So those risks are
broad,
there.
isn't it?
And that's why if somebody has the symptoms of a stroke, which thankfully have disappeared, they still need to take it seriously. They do need to go to their GP. They do need to say, had a really funny do last week. I was at home, I was drinking a cup of tea, and suddenly I dropped my tea because my arm just went, I had no strength. And I thought, oh my goodness, what's happening? And I tried to shout to Fred upstairs, and I couldn't get the words out. And I thought, oh my goodness, what's happening? And I just sat there really worried. And then an hour later, Fred came downstairs and said, what are you doing? And I could talk again. My arm was okay. So I'm absolutely fine. So does that matter? And the answer is yes, it matters a lot, because your doctor can then assess you and he can arrange for you to go and see somebody to check and see what's going on, because it may well be you need treatment to prevent the progression to a stroke. So for instance, he may check your blood pressure and say, oh my goodness, look how high your blood pressure is.
Right.
He may do a test and say, your diabetes is dreadfully controlled. There may be a blood test saying your cholesterol's very high. You may need scans. You may need all sorts of tests to see why you had that reversible stroke that only lasted a very short time. And so with the right treatment, we can prevent or definitely reduce the risk of you going from a mini stroke to a major stroke. And just in case anybody's ever heard, sometimes mini strokes are called TIAs, which stands for transient, that means short-lived, ischemic attack, that means reduction of blood supply to the brain.
Okay,
so a mini stroke or a TIA must be taken seriously.
I've heard within our communities that sometimes when somebody's having a stroke, family members have said to me, we massage their face really vigorously and their arm, and it seemed to help. Do you think it helps?
I think if you see a loved one going through a dreadful experience, your natural response is to want to help them. So I absolutely understand that you want to hold them tight, you want to stroke, hold hands. In actual fact, what you are doing cannot prevent or stop the stroke. Because if you think back, Robina, the problem is in the brain. The problem is the blood supply going to your brain, which affects the arm, but it's not the circulation in the arm which is affected, it's the circulation in the brain. So massaging a face, rubbing an arm will not reverse or prevent. I think it's a very natural thing. So
people shouldn't feel guilty for not doing something like that.
Oh, no. Yeah. And obviously, if you are the person, unfortunately, having the stroke, you must be so frightened, so worried. To have the nearness of somebody with you, I think is important. But that person should be ringing 999 before they start doing too much of anything else. That's what they need to concentrate on.
So this is a reminder of the tea and fast, that time is of the essence at this point. In terms of post-stroke, how likely is it that people can get back to driving if they were drivers beforehand?
Right. Well, again, everybody is different, and it will absolutely depend on how bad your stroke was, how disabled you are after a stroke. So again, everybody has an individual problem and must be assessed individually. What the DVLA, the driving licence people, say is, if you've had a stroke but after 4 weeks have no residual disability,
which means what?
Well, you aren't left with a real problem, like for instance, you can't use your arm. So providing you can still drive safely, you may drive.
Okay, so that's what...
So, and if sometimes it's not straightforward to know this, and that's when the doctor can advise you, the doctor can ring and speak to the experts in the DVLA who will say if you are safe to. But I'm being thinking of the people who have made a full recovery, perhaps got there in time, had their blockage treatment, and do not have a bad residual difficulty and are able to drive. So 4 weeks is the minimum that people can't drive for. But you must be in a position to be a safe driver.
I guess that comes back to the responsibility of the person who's had the stroke to recognise that the safety isn't just for themselves but for others on the road.
Absolutely, yeah.
A good point, thank you. We've talked about recovery time, and I wondered how variable is, because you're saying that somebody could recover within 4 weeks. Well, I get the impression that some people would never recover.
Yes, I think that's a very difficult question, because if when you say recovery, Robina, you mean back to completely how they were before they had the stroke, that may be very few people. But if you mean by recovery that the disability is so they can still function normally, they may not have the same strength in their arm, but they can live at home independently, dress themselves, go to work. They may not have the same strength in their leg, but they can walk around. They may have to be in a wheelchair, but they're still able to get around and do everything. Their speech may not be as good as it was, but it may well be enough for people to understand. So this idea of recovery depends on the person, the disability, and how far you mean back to as they were before the stroke came. Totally variable. You think I'm trying to avoid the question? I'm not.
No, because I think it's like you said, wherever your stroke happens is going to have a different impact on everybody, because everybody's so unique in what they experience, aren't they? So I guess it makes sense that understandably recovery is going to be so individual as well, and about how quickly you got to hospital, how much support you have, how you actively participate in your physiotherapy and things like that, I imagine too, is part of that process.
And I think
too.
we have to accept there are some people who will never make a recovery that's enough to go home. There are some people who will always need to remain having nursing care, may need to go into a special home. So a lot of people in nursing homes are there as a result of having had a stroke.
I mean, that touches really quite neatly onto the impact a stroke has not only on you, and we talked about personalities changing and the frustrations that a person can have, especially if they've had a very active or you know, prominent lifestyle and professional role, and suddenly that can all disappear. I wondered what you felt the impact is on family members who are carers in situations like that. How do we support people who are caring in these situations?
I think that must be very, very hard for somebody to have married, lived with a healthy, fit person, and then to find that that person's quality of life is so changed by the stroke. And again, I mentioned that there are organisations to support carers. Hopefully family will see if they can help in different ways. It may be something as simple as I'll do the ironing, I'll go to the shopping. So there's different ways. It may be just, I'll stay here this afternoon, you go to the hairdressers and have your hair done. You know, there's so many ways. But there are organisations who are there to support carers, and we mustn't underestimate how important those roles are.
I'm conscious that we've covered quite a lot, but I also think it's important to repeat some of it because of the sort of reality of how serious strokes are and how much we really want our community to take on board the importance of looking after themselves. So if I were to say to you before we did a full recap, what would be the key messages you'd want people to think about in relation to
prevention?
Yeah.
Prevention's always better than cure. So we should be thinking about healthy lifestyles. We should be thinking about, have we had our blood pressure checked? If we have diabetes, are we looking after ourselves properly? If our cholesterol's high, are we taking our cholesterol tablets? Are we getting plenty of exercise? So, are we a smoker? I need to say that again. Smoking so much increases the risk of having a stroke. If we've had a stroke before, are we making sure we're taking all the medicines we've been given, that our lifestyle is sensible? So prevention every time, better than cure. So let's prevent the stroke. If somebody is unfortunate enough to have a stroke, I hope the things we've mentioned about recognising it's happening and acting quickly are there for the person who might be having the stroke and for anybody who's with them.
I think we should get the picture back up for the fast.
Can we have our fast picture
and just
back, please?
as a quick reminder, because we've got literally 3 minutes left of the show. So
there we are. F for face, drooping of the face. What's A for, Robina?
Arms.
Arms. What would you notice with your arms?
Lack of strength, maybe not being able to move it.
Absolutely. Speech.
And that could be your legs as well, couldn't it?
Yes, of course it could be.
You know, we talk about arms, but actually it could be your leg as well, couldn't it?
Absolutely. Speech.
Yep, not being able to perhaps say the words that you think you're saying, getting the words wrong, slurring your speech.
Absolutely.
Yeah.
T.
Time.
Time.
Act fast.
Get on that phone. 999 brain attack.
I guess the biggest challenge is for somebody on their own that's having a stroke and they're recognising it and perhaps their speech has gone. I'm kind of hoping that emergency services would still be able to, if you've got enough to be able to phone them.
I think the emergency service people who answer the phone are very well trained, and I think that obviously they are aware of these sorts of problems, so I'm sure that we don't need to worry too much about that.
Any more you'd like to say before we wind things up today?
Right, having a stroke can be a dreadful, dreadful thing, but get to hospital quickly to see if we can help. If people do have a stroke, there is a lot of care that can be given to help them make as good a recovery as possible from the stroke, to go back to living as normal and as happy a life as possible.
And your top tip for today?
Fast!
Fast. Okay.
You knew I was going to say
I
that.
didn't know he was going to say that. Okay, thank you so much, Liz. That's been a really fascinating discussion today, and I think one of real importance and value to our communities. I certainly hope all of you that have been listening today can remember, if nothing else, remember fast. Remember to look after yourselves. Remember the importance of lifestyle in relation to your health. And hopefully we'll be seeing you again next time, inshallah. So, assalamu alaikum wa rahmatullah wa barakatuh.